Hemodynamic disorders presented by Dr. Nehal A Radwan. Today we will continue the hemodynamic disorders and will study hyperemia and congestion. ILOs. By the end of this lecture, the student should be able to explain the difference between active hyperemia and congestion, describe pathologic effects of venous congestion on different organs, and relate pathologic effects of venous congestion in different organs to clinical symptoms. Hyperemia. What is meant by hyperemia? Hyper, it means a lot. Emia, it means blood. So hyperemia means increase of the blood flow to a tissue. It is either due to dilatation of the arteries and arterioles, that is called active hyperemia, or it is due to stagnation of the venous blood in veins, venules, or capillaries due to impaired venous return, and it is called passive hyperemia or venous congestion. Active hyperemia is seen in the following conditions. It may be physiological conditions or pathological conditions. Physiological conditions, it can occur in muscular exercise, in which hyperemia occurs in skeletal and cardiac muscle, or in case of digestion, in which hyperemia occurs in splanchnic area. Also, active hyperemia, it may be pathological, as we see in acute inflammation in any part of the body. While the passive hyperemia or venous congestion, its causes always pathological, no physiological causes for the venous congestion. Three types of the venous congestion, and we will discuss it later: local venous congestion, pulmonary venous congestion, and systemic venous congestion. This diagram illustrates the normal and the case of the hyperemia and the case of congestion. Here is the normal arteriole with the capillary network and venule. But in the hyperemia case, there is an increase of the blood flow to the tissue due to dilatation of the arteries and arterioles, with accumulation of the blood in arterioles and capillaries. And as I mentioned, the examples for this hyperemia may be physiological, like exercise, or pathological, like acute inflammation in any part of the body. It leads to increase the blood flow to this tissue. This case of congestion here, it is due to increase of the blood in a tissue due to impaired venous return. There is decreased outflow, leading to stagnation of the blood in the veins and the capillaries. And the causes of the venous congestions, we will discuss it now. It is either local venous congestion, pulmonary venous congestion, or systemic venous congestion. This table summarizes the differences between the hyperemia and the congestion. As regards the site of the blood accumulation, as I mentioned, in case of hyperemia, the arterioles and capillaries, while in case of congestion, the site of blood accumulation in veins and capillaries. Hyperemia, it is active or passive process. It is an active process due to opening of inactive capillaries, while the congestion is a passive process due to stasis in already open capillaries. In case of hyperemia, the blood is oxygenated, while in case of congestion, the blood is deoxygenated. So the color of the affected tissue part, it appears reddish in color due to engorgement with oxygenated blood. And in case of congestion, The tissue appear blue-red in color, cyanosis, especially apparent in the labs due to engorgement with the deoxygenated blood. According to the causes of hyperemia, it may be physiological or pathological, but in case of congestion, the cause only pathological. Let's start with the local venous congestion. The local venous congestion, which the congestion is limited to part or area due to obstruction to the venous flow from it. It may be acute or chronic according to the types of obstruction. Acute local venous congestion, it may be seen in mechanical obstruction of veins like ligature, venous ligature, or twisting as valvulus or strangulated hernia, like here. It may be acute local venous congestion, could be seen also in caused by venous thrombus. Chronic local venous congestion, if the cause is chronic, the cause of obstruction is chronic, as occurred by some tumors pressing on a vein for a long time. It also caused by constriction of vein by scar tissue or by fibrosis, like the hepatic fibrosis, which leads to the portal hypertension. Now let's discuss the effect of the local venous congestion on the tissue affected. Here's an example for the left lower limb with mechanical obstruction of one of its vein by ligature of one of the veins of the lower limb. So we can see the left lower limb here, swollen, painful, dusky red in color. It may be due to dilatation of the collateral vessels, which leads to the varicose veins, and dilatation of small venules, which leads to cyanosis, increased transudation with edema and swollen left lower limb, and later trophic varicose ulcers could be occur. The second example is the strangulation of the bowel. It may follow hernia, valvulus, or intussusception. The mechanical obstructions of the veins leads to the congestion and edematous tissue, but more obstruction of the swollen tissue leads to arterial flow obstruction and leads to necrosis, and finally, with superimposed bacteria, leads to gangrene. Here is also an example for the chronic local venous congestion. This is the liver, and the liver shows cirrhosis, which leads to constriction of the portal vein by scar tissue and by fibrosis. So there is obstruction of the venous blood flow within the liver. This leads to anastomotic channels between the portal and the systemic circulations becomes dilated, tortuous, and engorged with blood, like here. And now let's continue the other two types for the venous congestion, which are systemic venous congestion and pulmonary venous congestion. And their causes are always due to heart problem. As regards the systemic venous congestion, its causes due to right side heart failure, due to pulmonary valve stenosis or pulmonary fibrosis. Let's remember together the heart circulation. This is the venous return and superior vena cava and inferior vena cava carrying the blood which is deoxygenated blood from all the body and goes to the right atrium, and then to the right ventricle, and then to the pulmonary circulation through the pulmonary artery, and then the blood goes to the left atrium. The blood here is oxygenated, and then to the left ventricle, and then to the aorta to go to the all parts of the body. This is a normal circulation. So let's think, if there is right side heart failure, which is the cause for the systemic venous congestion, due to any cause, maybe pulmonary valve stenosis or emphysema or pulmonary fibrosis. So what will happen? All the blood which is deoxygenated will be accumulated in veins all over the body, except the pulmonary veins, and sparing the lung tissue. So the blood here, the deoxygenated blood in systemic venous congestion, it will be accumulated due to right side heart failure in all over the parts of the body, except and sparing the lung tissue. And now, what are the clinical features for the systemic venous congestion? The clinical features, you could see cyanosis, like here, which are the bluish discoloration of the tissue, especially apparent in the lips, due to the presence of abundant reduced hemoglobin. And also you can see as a clinical sign the congested neck veins due to increased venous pressure, edema of the lower limb, mainly due to increased venous and capillary pressure and hypoxia. Also, there may be enlarged tender liver. And now we will discuss the third type of venous congestion, which is pulmonary venous congestion. Pulmonary venous congestion, it causes maybe left ventricular heart failure due to coronary ischemia or hypertension, or it may be due to mitral valve stenosis. And also let's remember the venous and heart circulation. Here, if there is left-sided heart failure, so the blood, the heart couldn't pump the oxygenated blood to other parts of the body, and so the blood will be accumulated in the pulmonary circulation, in the pulmonary veins and their tributaries within the lung. And its causes may be due to, as I mentioned, mitral stenosis or left side heart failure due to any cause as systemic hypertension or coronary heart disease. So the effect of the blood accumulation in the pulmonary veins and their tributaries within the lung. In case of the pulmonary venous congestion, the clinical signs will be orthopnea or dyspnea, which is difficulty of breathing. And now, let me ask you a question. What are the organs affected in the right side heart failure? This is to summarize the previous part. What are the organs affected in the right side heart failure? Yes, all parts of the body affected except the lung tissue, and this type of congestion is called systemic venous congestion. The second question, what are the organs affected in the left side heart failure? Yes, the lung, tissue is the organ that is affected in the left side heart failure, and the type of the congestion is called pulmonary venous congestion. And now I want to ask a question. Can systemic venous congestion associate pulmonary venous congestion? C. Both systemic venous congestion and pulmonary venous congestion in the same patient? Think well. Yes. Systemic venous congestion could associate pulmonary venous congestion. In which case, if there is left side heart failure, which leads to pulmonary venous congestion, as I mentioned before, but if the pulmonary venous congestion stands for a long time, it will lead to pulmonary hypertension, which is consequently lead to right-sided heart failure, which ends to systemic venous congestion. So the systemic venous congestion could associate pulmonary venous congestion, and this is a very important question. And now we will discuss the pathological changes in the chronic venous congestion. For the systemic venous congestion, as I mentioned, all the body affected except the lung, and we choose two examples, two organs as an example for the changes in the systemic venous congestion, which are the liver organ and the spleen. As regards the pulmonary venous congestion, we will discuss the changes in the lung tissue. Also in your lab and museum sections, you will study the effect of the pathological changes in these organs in details. We will start now with the lung tissue. This is the gross picture, the gross appearance of the lung tissue in case of the venous congestion, pulmonary venous congestion. The gross pictures show here the lung tissue is heavy, enlarged, firm, shows deep red color, which is called brown induration, and its cut surface shows frothy blood on squeeze. This is the gross appearance of the lung tissue in case of the venous congestion. This is a microscopic picture of the chronic venous congestion in the lung tissue. Here we can see that pulmonary venules and alveolar capillaries are dilated, and the alveolar walls or alveolar septa are thickened due to edema in early condition and later due to fibrosis. The alveolar spaces, these are the alveolar spaces, contain red blood cells due to microhemorrhages, and also contain edema fluid from increased hydrostatic pressure. And the most important cell, which is characteristic for the chronic venous congestion in the lung, the cells called heart failure cells. These are heart failure cells. Here, the brownish cells here, it is called heart failure cells. This picture shows a more high power for the heart failure cells, which is the brown cells here. The heart failure cells are large cells with vesicular nuclei and contain in their cytoplasm engulfed red blood cells with their degradation products, which is brownish hemosiderin pigment granule. This is the alveolar septa here, which is thickened, Again, this is another picture showing the microscopic picture of the lung. This is the alveolar septa, and the alveolar space here contain red blood cells, heart failure cells, as I mentioned. The arrow, the thick arrow, shows the heart failure cells, which is a macrophage, large macrophage with brownish hemosiderin pigment granules. And the alveolar walls thickened due to edema in early condition, and late due to fibrosis. And now I want you to test yourself. What do the black and white arrows point to respectively? Think well. Yes, I can hear you. The black arrow points to heart failure cells. And now we will go to another organ, which is the liver, and we will see the effect of venous congestion on its tissue grossly and microscopically. This is the gross appearance of the liver tissue in case of the venous congestion. We can see that the liver tissue is enlarged, firm in consistency, and its cut surface shows a very characteristic appearance, which is only could be seen in chronic venous congestion of the liver, which is nutmeg appearance. This is the nutmeg appearance. Nutmeg appearance, it is means like goes at the tip. If you open and getting cut to the goes the tip, its cut surface, it's like that exactly, as I will see you show you in the next slide. This nutmeg appearance, because the alteration of the dark areas with yellow areas. Here the normal liver tissue, as you see in this picture. This is a normal healthy liver tissue, but this is chronic venous congestion, the cut surface of the liver in chronic venous congestion, showing the nutmeg appearance. The nutmeg appearance is due to alteration of pale areas with dark areas. So why there are dark areas and pale areas? The pale areas here are due to fatty change, and the dark areas represent the dark areas of congestion. So this alteration with pale and dark areas get the picture of the nutmeg appearance, which is جثة الطيب. الكات section بتاعها اهو. It is very characteristic for the chronic venous congestion of the liver. And this is another example and another picture. And this jar you could see in the museum section. This is a cut section of the liver tissue. You know the liver, that is liver tissue from the portal tracts here and here and here. This is characteristic for any liver tissue. And these alteration, dark areas with pale areas, the pale areas due to fatty change, and the dark areas due to congestion. These alteration leads to the characteristic nutmeg appearance for the chronic venous congestion. And now, before discussing the microscopic picture of venous congestion on the liver under microscope, I want you to remember the histological picture of the liver. It is composed, this is hepatic lobule composed of the central vein, and this is the portal tract area. Contains a branch of hepatic artery and branch of the portal vein and bile duct. And the hepatocytes are arranged in plates, and the blood flow goes from the portal vein towards to the central vein. I want you to just remember also that the right and left hepatic veins open into inferior vena cava immediately inferior to the heart, and this arrangement makes the liver liable to chronic passive congestion. Let's think together that if the central veins of the hepatic lobule becomes dilated here from the congestion, so there is increased venous pressure, which is transferred to the sinusoids, which become dilated and engorged with blood. And these dilated sinusoids make a pressure atrophy on the centrilobular hepatocytes. Centrilobular hepatocytes, this means that the hepatocytes around the central vein. And now this is another diagram for the hepatic lobule, which is composed of central vein and the hepatic sinusoids, and the portal tract contains the three structures: bile duct and branch of portal vein and branch of hepatic artery. The changes occur in the liver tissue. In chronic venous congestion, we can divide them into three parts or three zones. First of all, the central vein becomes congested together with the hepatic sinusoids. The first zone, which is the zone of hepatocytes around the central vein, shows necrotic hepatocytes. The centrilobular hepatocytes show necrosis. This is due to pressure necrosis and anoxia from the congested central vein and sinusoids. The second zone, which is mid-zone between the central vein and the portal tract, this is called mid-zone, shows fatty changes. So the fatty change due to relative hypoxia. And the third zone, which is normal, the hepatocytes around the portal tract, the periportal hepatocytes, this is not affected by hypoxia or anoxia because they are better nourished as they are near the portal vein and hepatic artery. Here is the picture you will see under the microscope for the liver in case of chronic venous congestion. The central vein here, in the early condition, the central vein and the sinusoids in the central zones of the hepatic lobule are dilated and engorged with blood. And the hepatocytes between the dilated sinusoids show fatty change. This is the mid-zone. As I mentioned in the previous slide, this is the fatty change in the mid-zone of the liver, while the peripheral zone, the periportal zone, periportal hepatocytes are normal hepatocytes because they are not affected as they nourished well because they are near to the hepatic artery and the portal vein in the portal tract. This is in the early phase of the chronic venous congestion of the liver. With the advance of the condition, this is the central vein and this is the sinusoidal dilatation. With the advance of the condition, the sinusoidal congestion and the dilatation extend peripherally in the hepatic lobule, and the hepatocytes, these are the hepatocytes in the central zone, becomes atrophic and necrotic hepatocytes, while those in the mid zone develop only fatty change. With more advanced for the case, in all cases, central lobular fibrosis occurs and regenerative nodules of the hepatic parenchyma can develop, leads to cardiac cirrhosis. And now we go to the pathological changes in the last organ as an example for the chronic venous congestion, which is a spleen. I want you to notice this. What is the difference between both pictures? Both pictures for the splenic tissue. This is a gross appearance for the splenic tissue, but this is the normal appearance for the spleen, and this is the characteristic feature for the gross picture of chronic congestive splenomegaly. The spleen is moderately here enlarged, firm in consistency, and its cut surface shows a dark red cut surface due to congestion. This jar you will study in your museum section. The spleen tissue here is markedly enlarged with preserved notch. This is called the notch of the spleen, and its cut surface or cut section is brownish in color due to congestion and shows sometimes scattered brownish flakes, which is called fibrosidrotic or gamma-Gandhi nodules. And now, as regards the microscopic picture for the congestive splenomegaly, here this is the normal tissue of the spleen under microscope, and these are the sinusoids, are empty and clear, but here the red bulb sinusoids are dilated and engorged with blood, and their walls are thickened due to fibrosis. Also, a characteristic appearance for the microscopic picture of congestive splenomegaly is fibrosidrotic nodules, which is called also gamma-Gandhi nodule. They are composed of fibrous tissue entrapping hemosiderin, and they are result from hemorrhage from engorged veins with the hemosiderin liberated from the broken red blood cells, inducing the fibrosis. This is another example for a microscopic picture of the spleen. You can see here that the red pulp sinusoids dilated and engorged with blood, and their wall are thickened due to fibrosis. And these are the fibrosidrotic nodules here and here, which is simply fibrous tissue around hemosiderin. And now, by the end of this lecture, we studied today the hyperemia and the congestion. And the terms hyperemia and the congestion both indicate a local increased volume of blood in a particular tissue. And we studied that hyperemia is an active process resulting from augmented blood flow due to arteriolar dilatation, and we studied its causes like physiological as skeletal muscle during exercise, or pathological as in site of acute inflammation. Also, congestion is a passive process resulting from impaired venous return out of tissue. And the three types of the venous congestion is either local, resulting from isolated venous obstruction, or systemic or pulmonary due to cardiac failure. And also we discussed in details the effect and morphological changes of venous congestion on three different organs. This table will summarize the most important pathological features of venous congestion on three different organs: the lung, liver, and spleen. As regards the gross pictures, all the organs are enlarged and firm in consistency. As regards the lung, the cut surface, frothy blood on squeeze, and don't forget the nutmeg appearance, cut surface of the liver tissue in chronic venous congestion due to dark areas alternate with yellow areas of fatty change. Also, don't forget the fibrous hydrotic nodules of the cut surface of the spleen. As regards the microscopic picture, the most important cell, just to be remembered, the heart failure cells, as alveolar spaces filled with them. As regards the liver, we can see that the central vein dilated, the central zone of the liver showed hepatocyte atrophy, and the mid zone showed fatty change. As regards the spleen, don't forget the fibrous hydrotic nodules, which is fibrous tissue around the hemosiderin. Thank you. And now, by the end of the lecture, try to test yourself by these sample questions. Match the following: hyperemia, fibrous hydrotic nodules, heart failure cells, nutmeg liver. Think well. So I will start to answer. Concerning the hyperemia, you choose what? Yes. Hyperemia, one of its physiological causes is muscular exercise in skeletal muscle. Concerning the fibrous hydrotic nodules, you choose what? This is characteristic for chronic venous congestion of the spleen. C. And where you will find the heart failure cells? Yes, in the pulmonary venous congestion. And last, the nutmeg liver, which means pale areas alternating with dark areas in the cut surface of the liver. Thank you.